Hillsborough County has teamed up with the Department of Health and other public health and safety agencies to address any impacts the virus may have on our local community. To help prevent the spread of the coronavirus, here are a few tips you should know. Practice proper hand washing by using soap and water and wash for at least 20 seconds. Use alcohol-based hand sanitizer if you cannot wash. Avoid touching your eyes, nose, and mouth. Cough and sneeze into a tissue and throw it away. Clean, high-touch surfaces frequently. Some examples include doorknobs, credit and debit cards, cell phones, keyboard and mouse devices, and toilet handles. Stay home if you're feeling ill. If you have any flu-like symptoms, avoid contact with the public. Avoid sharing personal items in spaces with those close to you. Seek medical care early if you're feeling sick. Symptoms of the coronavirus can include fever, coughing, and shortness of breath. Seek medical care if you develop these symptoms or if you've been traveling or have been in close contact with a person who has traveled from an area with an ongoing spread of COVID-19. We encourage you to visit hcflgov.net/staysafe for up-to-date information and tips.
So due to our closures of all of our congregate dining centers and senior centers because of the COVID-19 pandemic, we have 26 different locations that we're still providing meal services for, although today is one of our 10 grab-and-go locations. The grab-and-go locations were established at the locations where seniors live in our senior high-rises, senior apartment complexes, and for that we work with our food vendor and we're able to literally bring frozen meals to our seniors, and then we're delivering 14 frozen meals to our seniors every other week, so we make sure that they continue to receive the nutritional meal that they would have if they were still attending one of our congregate dining centers.
The meals are wonderful. To me, they're restaurant quality. There's a wonderful variety. It's quite enjoyable. We're used to coming downstairs, having lunch every day, and most of us have given up our cars, so we don't have a car. We don't have the bus to take us to the store, but it would be worse if we had to put together meals ourselves with what we have. To know that the county is taking good care of us and bringing these frozen meals to
Okay, well, we'll go ahead and call the meeting to order. This Health Council of West Central Florida. This is, in fact, our annual meeting, June 11th, 2020, 3:30. I'd like to welcome everybody. Thank you everybody for logging on. We're doing this online. We're not meeting in person, obviously. So I appreciate everybody taking the time out of the day to go through and get all this set up and take time out of your busy schedules, obviously, to meet with us. First of all, anybody from the public online, any public comments at all? Okay, doesn't sound like it.
We haven't received anything in writing either, so.
All right, perfect. Next, let's go ahead and adopt the minutes from the meeting of April 9th of this year. Y'all should have gotten that in your emails that Teresa sent out yesterday or a couple of days ago.
Yes.
It's just one page, pretty straightforward.
I make a motion to adopt the minutes as provided.
Very good, thank you. Can I get a second?
I'll second that. This is Lee.
Great, great. All in favor, say aye.
Aye.
Any opposed? Okay, the ayes have it. The minutes have been adopted.
Okay. Since Kimberly's not here, I'll try to go over the treasurer's report with you. I just need to pull it up here. I'm trying to do that right now. So we did this yesterday, but now I can't seem to make it work. Let's see. What the heck is that? Let me see if I can get this screen to share here. Share content. Let's see. Okay.
Yeah, you're doing it.
So here we go. All right. Okay. So just kind of doing the quick run through on the profit and loss statement. As we go, I won't hit every single line item for you. That's our summary. So while it shows a negative 27,000, remember we're always behind on our receipts. So we have about 24,000 coming in from Polk County. Actually, it came in on June 1st, so it didn't make this statement dine. So we're actually doing pretty well this year, certainly as compared to last year. I think we're going to end the year pretty strong. And let me see, did I do the, okay, so I think I forgot to load up the other one. Anyway, I had the one by contract as well. So just so you know, the billings are on target with all of the contracts, and the deliverables are coming in. So as I said, I expect it will be hitting in a much better position than we were last year. I'm sorry, I thought I had loaded up the by each contract one, but apparently I didn't. And I guess that's pretty much everything is on target as far as our expenses. Our large expenses that went out in May were for our directors and officers insurance and our liability insurance. So if you may recall, we have 2 quarters where we have some rather large expenses. The one is when we do the audit, and the other is the quarter when we do the insurance coverages. So all of that across the year now has balanced out pretty well. So I think we're gonna be in good shape. Certainly better than we were last year. But let's see, what else do we have here that might be of interest here?
So the accountants will be happy.
Yes, the accountants will be happy. I am meeting with Rob next Tuesday, and we're going to start the closeout for the fiscal year, start getting together all our papers and making sure we've got everything there so that we can be ready to hand it off to the auditors as soon as they're ready for it. So if we can get that to them, usually the audit is conducted in early August, but I'll let them look at what we have, and then if there's anything that needs to be corrected or adjusted in our books, then they can make sure we've kind of got all that together. So we should be on target with all of that.
So go ahead, Lisa.
No, I'm sorry. That's it. Go ahead.
I was just going to say, so if what you're looking for is what I'm thinking, you sent that to everybody, so everybody has a copy of
Yes.
the contracts where it says DOH, Medication Assistance, Health Council West Central Florida, the ETE, and the in-kind.
Correct.
You're talking about, correct?
Yes, that's correct. I just forgot to load it onto this package. I'm sorry.
Right, you're okay. So Can everybody pull that up by themselves?
I looked at it before we got on today, but I'm not sure about getting it right now.
Okay. Well, essentially total salary is $123,000, and they go to say Department of Health pays for 54, medication assistance 48, Health Council 19. What's the ETE stand for again?
That's the ending the HIV epidemic.
Okay, that's right. That was 11,000. She's got the fringe benefits on there, which includes the retirement and the payroll taxes. The payroll administration, obviously, how much we pay to for the payroll company to keep that running. The travel, total was 5,200. You highlighted 1,700 for the Health Council of West Central Florida.
That's on the proposed for next year budget. That's next year's budget thing that we're looking at. That's the next agenda item. Yeah, that's the next agenda.
Okay. All right. So we don't have the thing that you're talking about.
Yeah, let me see if I can find it here. Hold on just a second. I might be able to. No, I think I do. Excel. I've got the Excel sheet now, whether I can show this or not. Is that showing up?
Yeah, we can see it if
It
you
is.
want.
It is.
Okay, great. All right, so this is the other one. This is the through May 30th issue. So ETE was the ending the epidemic. This was kind of by class. So here's kind of our bottom line at this point. We had, we made $1,552 profit on the conference. We're only down 8,000, but we have 24,000 that's due. So, on Polk County, we're doing good. The Bay Care evaluation project came out fine. That was all back to reserves, money that went back to reserves. We had the ending the epidemic. That pays us monthly. So from a cash flow standpoint, that's great. And the Allegheny Franciscan, that was awarded in the last fiscal year, but we had to carry some of the expenditures over into this year. So it's all moved over, but we've purchased everything and done everything under that award. So that we've received the $8,150 last fiscal year. It just gets expended in this year. So this is where we're at with reserves right here, which is, negative $8,189. And that don't anticipate that getting any worse between now and the end of the year. There isn't anything else coming out of that in salaries or anything else. All of that's been being charged elsewhere. Unclassified, this is just an entry error, which needs to go back to the DOH core contract. Those two were just classified incorrectly. And so this is kind of our bottom line that matches up to the other figure, the other 27,000 that we saw. But that's that same profit and loss statement across each of the cost centers that we have.
Okay.
Okay, let me get that one down. Okay. Let's see. Then we have. So then the next item was the budget option for next year. Recall at the last meeting we approved the base budget that we had, but was requested that I come back and bring something that because Allison's the position of special project manager, we only have that funded through August. And while we expect there will be other funding coming in, there's going to probably be a gap in that time. I'd like to try to keep her employed during that period of time just at 10 hours a week. So it's a 0.25 full-time equivalent, which would hold her hopefully during that period of time while we're waiting for some other things to come in. We have a subcontract from another agency that wants to subcontract with us to do some work. They haven't seen their final contract yet, so we haven't seen our agreement yet. It was hopefully supposed to be taken care of by the end of July, but we just don't know what the timing will be on that. There's also another grant proposal we're going to be submitting that will also be coming up in August that would also be able to fund some of her position if we were able to get that. And then there's always other potential possibilities that we've got our fingers on right now, but it's a timing issue, frankly. And I would not want to lay her off completely if we can avoid it, because I do have about 10 hours of work that she can do to help us advance those causes, such as doing some more grant searching and things that I don't really have the time to do. So that's what I'm proposing here. This assumption would be if no other funding was found, and if COVID-19 is such that we can do some more traveling. I did budget some travel in for that position, for that quarter time position for the rest of the year. So that would come to a net cost of a gross cost of about $14,410, which in the budget we looked at last meeting, we were looking at contributing $7,000 of which might not be needed because it was budgeting for things like legal fees that we may or may not tap. And then with this option, the total potential would come to $30,000, and that same $7,000 might not be needed, but also recognizing that all of this might not be needed either. This is based on from basically a 10-month period of time if we were to keep her at a quarter time in there. And so then this is then how all of that works in the same budget that you got last meeting. This would be how that would now be impacted. So you would see this salary item here. You would see, and the total fringe benefits that would then be attached to that. Staff travel, that would again be to support her attending some meetings and doing some things. This is the internet expense that we give them from working from home. These would be supplies. And then as you see, these were the other ones that were already in there that may or may not be addressed. And so I wanted to just see, and then, so how that would impact that $30,000. So the bulk of that really is coming in the salary and benefits situation. The only other thing we have is we have some supplies, we have some telecommunications, and we have some local travel. So that was how that would flesh out if that's what you do. But I do have enough work that I can give her that amount of time and still, feel like that might be enough to keep her hold position if we need to.
So as far as first of all, just the 10 hours a week, which would give her time to search for funding, as you said, grants and also program development.
Right.
Obviously that's important to have somebody looking
Yes.
for that. Obviously that's how we're going to make money and keep things
going. Yeah.
Is she good at that? Is she pretty?
She is, and she's motivated because it's mostly for covering some of her salary. So she's actually quite motivated to do it, and expressed when I discussed this possibility with her, she said that she thought that would certainly be something she'd want to do, and we do feel there are some good potentials out there. It's a timing thing, and we're not sure, how that's all going to fall out. And again, this is the worst case scenario. If we had it and got nothing else in during the year, we do that. But she also has other employment. So she works she does adjunct teaching for USF as well. So it's not, she's not completely dependent on that for her living. So.
Well, and we'll know more by
I would say by October, we'll kind of know where we're at with that.
All
And,
right. So
and I think that she would hang in there at least for that long. And then we may have to assess where we're at that point.
right, because at that time we could make a decision. Well, if we're not getting anywhere, if we're not
Right.
getting any extra funding, then we could make it a change and
Exactly. Yeah.
let her go.
Yeah.
So it's not like we're stuck on the bill. We don't have to give her a year contract and none
No.
of this is going to
No,
come out.
no, she's aware of that. Yeah.
So the this is $665 a month for telecom, but this other one says
Yeah. Yeah. So that's one expense related to it. A portion of the staff travel is that $1,700 is the total. There was we had some originally in there just for those things that might come up that we can't bill to a contract that would be helpful. 1,200 of that would be related to that position. And the supplies of about $800, just depending on what we need. And mostly, frankly, that, things like toner cartridges, which, run us about $100 for a toner cartridge per printer. So,
So does she need $65 a month for, is that a phone or is it just internet access?
She uses her personal cell phone and her personal internet. So what it is it's our remote policy allows for us to give them a partial reimbursement on their expenses for using their equipment. She did not want a separate phone. She preferred to use her own. So there's a portion of an allocation in there for her phone.
And even if she stays for a year, travel might not be $1,700.
Right. And the same thing with if funding comes in, the internet stuff would shift over to the contract. Yeah.
And
So
what's the legal fees?
legal fees was just the estimate. That's kind of the placeholder we've been using over the last few years in the event that something comes up and the board is not able to meet, and I need to at least call the attorney, and I would obviously talk to the executive committee first. But if something comes up, that's just a placeholder so that we wouldn't have to come back to the board and get approval for something, that was under $3,000 that needed to simply be dealt with. We haven't had to use that. We haven't had any of that since we did the split. The first year was the only year we had some legal expenses there. And this business development marketing, that was just if there is an opportunity that comes up or something that could be helpful for us to do. It's just saying in advance we're allowing up to that amount of money without having to come back to the board for the budget. But those figures can be deleted. They can be reduced. You can do whatever you want with those figures. That's just how we have historically done it. So that's kind of where I left them, as they've always been.
Good base. Well, I personally think that it would be a good idea to try to keep her on and continue. We may be able to get something extra out of this. Obviously, if we don't, then we can cut our losses in a couple of months. But I think it's definitely worth a shot. And I think chances are that we'll get that funding to keep her on. I hate to lose her.
Yeah, me too.
Because it seems like she has helped out a lot and you like her. And
yeah, it's a good working relationship. It's working pretty well. And
what does everybody else think? Leslie, did you say something? I couldn't hear you. You might be on mute.
I'm sorry, I was muted. Yeah, I definitely think it makes good sense to move ahead with this situation, and I think it'll be a positive. If it's not, then we'll do what we have to do.
Yeah. Kim and Lee, what do y'all think?
I agree with it. Yeah, it makes good sense.
Good. Lee, you might not be able to.
Lee, are you still there?
Lee, I think you're muted.
I am muted.
Oh, there you are.
Funny when you mute yourself and you don't even know it. Sorry about that. Yeah, I think that as we're saying, that she's been productive. She's Allison's appreciated by Teresa, and good working relationship, and there's lots of opportunities that she might find out there for additional contracts. And so you don't want to sever a relationship with somebody who's been valuable, and
Good.
if you don't have to. So.
Good. So, Teresa, do we need to vote on that?
Yes.
Okay. So do we need two different votes? One to accept the financials and the other one to accept the option and the budget, or how do you want to do it?
Yes. Well, yeah, exactly. One is, the first motion is to accept the treasurer's report, and the other is to
Accept the option.
accept the
Or
option one.
Okay. All right. And then what about the potential budget? Do we have to vote on that?
Well, the first budget you voted on last month, so you're just voting on amending the budget to option one.
Option. Okay. All right. Well, let's first then see if I can get a motion to accept the financials.
I move that we accept the treasurer report. Is that what you need first?
Ma'am. Good. Could I get a second?
I'll second that.
Right. All in favor, say aye.
Aye.
Any
Aye.
opposed? All right, the ayes have it. Now let's vote to accept the option to the 2021 budget pertaining to Allison. Could I get a motion to accept that?
So moved.
And could I get a second?
A second.
Very good. All those in favor, say aye.
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 Any opposed? All right, ayes have it. All right, so Teresa, you went over some in your ED report.
Right. Right. So contractually, we're in good shape. The only thing I want to kind of point out when we, with the Polk County project, since they are clinic-based programs, staff was working from home and going in about once a week to the clinic sites. She's now going into the clinic sites in the mornings and working from home in the afternoon. Patient loads have dropped down since a lot of folks were not going out for routine medical care during this time. So we're expecting that, the numbers are starting to pick back up in June. But I think we're going to ultimately, by the end of the year, we're still going to be in good shape. And remember, that contract runs through September 30th. So I think all is well there, and hopefully we'll have more of that coming back in. And we do have a new relationship with a behavioral health clinic that's going to start using our services in July too. So that's we've been talking with them for the last couple of weeks. So that's going on.
Good.
So basically, as I said, we're beginning the fiscal year closeout. We had submitted a funding application to the Gulf Coast North AHEC, which is the Area Health Education Center. They're supposed to make some decisions by the end of this month. It was really to help do some unconscious bias training for students in health professions. So we'll see how that comes out. I'm also in the process of been reaching out to Manatee County initially because we've had some conversations in the past. Florida Blue is supposed to be letting out an RFA in August to deal with health equity. We don't know what ultimately it will look like, but I'm going to be making the rounds, talking to each of the counties and seeing if they have projects that maybe a nonprofit has to be the applicant. So we might be able to partner with some of the health departments or other agencies within there to develop a project and submit something in a joint collaborative. So we won't know the specifics until the RFA comes out, but we're trying to kind of get ahead of it and get some project ideas outlined. And then when we see what the criteria is, we'll see which fits best. and go from there. Other than legislative updates at this point in time, we'll probably continue to have the ability to meet this way until the governor rescinds his executive order around the sunshine law issues. So we'll just have to kind of keep flexible. Our next meeting isn't scheduled until August, so by then we probably will know something, you know, whether we're still able to continue to do this or not. So
Right.
pretty much the summary there of what's been going on. Any other questions?
So have any of the health councils gotten any money for any of the COVID-19 testing or anything to do with that you've seen?
There's two that actually also operate rural health clinics. And so those have gotten it, but they've gotten it from the rural health clinics side. So you're not in the planning side of things. That really hasn't been a lot with that, but yeah.
Okay. So, but that may be something down the pipeline.
Yeah. And I do think that we're going to maybe be seeing some stuff around health equity, some money coming down, at least on the foundation side. I don't know where the government will come out, you know, obviously with all the money they've been spending on stimulus.
Right.
We don't really know how that will impact funding in the future. But I do think we're seeing a lot more foundations mobilizing around those issues. And so I think that there will be opportunities there. Hillsborough County is looking at doing a health equity report right now and trying to do some groups around that. We're involved in those conversations. I'm also involved in something with the Department of Juvenile Justice that's going to be looking at those things as well. So, you know, kind of getting into the mix and into the discussions puts us in a position to see where we can be of assistance, you know, and hopefully seek funding for that. So
Good. Very good. Does anybody have any questions about Teresa's report? Okay. Any new business to bring up? So when will we won't meet with the accountants in August, it will be the next one, right?
yeah, they usually meet with us in October,
Yeah.
but the audit actually happens in August. So,
Okay.
yeah.
So yeah, that's true why we couldn't meet today in person, because this is usually when this is our annual meeting. We usually have food and all that kind of stuff.
We've already talked about that, yeah.
Yes, we decided that when we're all able to come back and be in the same room, we'll do it then.
Definitely. Good. Okay.
Everybody bring a covered dish.
That's right.
Right, with a mask.
Right.
So, anybody else have anything else to bring up at all? Any other new business to discuss?
No.
Okay, perfect.
Well, thank you.
Thank you. We can meeting adjourned. Appreciate everybody showing up.